Dr. Din here, and it looks like we have some questions to answer. What do you recommend to someone who is prone to cavities but doesn't want fluoride toothpaste but is also very dedicated to oral hygiene? That's a great question. It kind of goes towards first principles in dentistry, and it brings up the question, how does a cavity form? A cavity forms when you have a high amount of sugars in your mouth, and this could be not just the sweet sugar stuff, but things like carbohydrates, like breads. So if you have a higher exposure to sugars in your mouth, over time, bacteria grows in that type of environment. As more and more bacteria grow and they eat those sugars, they release acid as a byproduct. Over time, your mouth gets more and more acidic. And as it gets acidic, your mouth has to be at a pH level of 5.5. So pH level is the level of acidity that is measured. And at that level, if you have a pH of 5.5 for over 1 hour, that is the exact environment in which a cavity can form. So the quick and easy tip is to, after a snack or after a meal, to just rinse your mouth with water so that pH is reset. The pH doesn't get to 5.5, and so cavities don't form. Brushing your teeth after meals is always a good thing. Basically, not letting the bacteria consume your food inside your mouth. So things like mouthwash is a good idea after meals, especially having mouthwash and flossing before you sleep at night. That helps a lot. A really good thing also is a water pick, a water flosser. Everyone kind of goes through the same type of journey in their life. They go from, hey, can you brush your teeth, please? And you're like, I'm not going to brush my teeth. And you start brushing your teeth, and it's like, hey, can you floss, please? And then you start flossing your teeth, and it's like, hey, can you use mouthwash? And then use mouthwash, and then you do all those things, and you're like, hey, you have periodontal disease, can you use a water pick? And then use a water pick, and all of a sudden, if you've gone through the process and you've paid your dues in dentistry, the expensive bill due in dentistry, then you know that you start doing all of those things, and you become stable, and then things break, and then we fix them when they break. So something to consider, and hopefully that helps.